I recognize Dr. Bera from California for 5 minutes of questions.
Thank you, Dr. Walensky, for your service and certainly your work as CDC Director. Mr. Chairman, I have the privilege of sitting on the CSI Commission for Strengthening America's Health Security, and one of the task forces that a subgroup put together a report, Building the CDC the Country Needs, comprehensive. It included former CDC members, nonpartisan health experts. I'd love to, Mr. Chairman, I'd love to enter that to the record.
Without objection.
Great, thank you. Dr. Walensky, one of the recommendations out of that report was looking at a reorganization plan, and I know you undertook the reorganization plan. I'd love to get a sense of major findings and the status of that reorganization.
So among the things that we learned is that there were layers of bureaucracy that were happening that within the agency, that things that were really essential, our public health infrastructure related things, our Office of Readiness and Response, our laboratory systems, our data systems were buried in layers of bureaucracy and not within like the immediate Office of the Director line of sight. So among the things that was so critically important in this reorganization that was completed, I believe, in the end of February, and we're actively acting under that new reorganized structure, was to have those layers, those really important public health infrastructure components, science, data, laboratory, readiness, report immediately into the Office of the Director, full line of sight, and to get rid of those bureaucracies.
Great. One of the other recommendations, and you touched on this, was on the communications front and how we translate the science into guidance in a way that, I watched my wife who's also a physician and runs a large system of community health centers, going to the CDC website on a daily basis during the pandemic, using that information to provide guidance to her healthcare professionals, but also how do you translate that science knowing that lay members of the public were now going to the CDC website? You touched on it a little bit, but could you expand on some of the efforts there?
Yeah, I think you hit the nail right on the head. As a consumer, before coming to the CDC, you put C in my Google bar and it came up with CDC, right? We were on the guidance all the time, and most people hadn't heard of the CDC. So it was the people, the healthcare workers, public health workers, who were in the trenches who needed to know and understand. The language was for them. All of a sudden, CDC was splashed across the pages. People were, it was in the news. People were going to CDC guidance themselves. It was never really intended for the average American consumer to consume our web pages. And we now need to recognize that that is who our audience is, and we need to be able to have an audience for our public health workers, our healthcare providers. But we also, we also need to have web pages that are consumer ready for the American people so that they can say it in lay language that they understand.
Great. And you touched on this, the workforce issues and building a public health system that we deserve. The pandemic really did expose an under-resourced, fragmented public health system, where data wasn't shared readily or quickly, where we weren't doing disease surveillance, wastewater surveillance, and a lot of deficiencies in our public health system. It'd be a shame for us in Congress not to take the resources and put those resources into a public health system that we all deserve. One of the areas that I really worry about is some of the rhetoric coming out of the pandemic really does erode trust in what should be the most trusted public health organization in the world, the CDC, which historically has been, but it's multiple other areas, and that we're discouraging that young generation of folks who really did grow up in the midst of a pandemic. This should be a time where they're stepping up to come work for us. Maybe in the short period of time that I have, if you could just reiterate the things that we should be thinking about in Congress to help build that workforce.
Maybe I will just emphasize, thank you for that opportunity. This nation is an estimated 80,000 public health workers in deficit to perform and that is a report outside of CDC, to perform the standardized public health duties of this country. We need public health workers. In order to do that, certainly tax exempt loan repayment, so people are encouraged to go in. People leave medical school with $200,000 in debt, so they're encouraged to go into this field. It's an incredible field, and yet during this pandemic, we have some health departments that report 50% of people leaving. We need those public health workers if we are going to be primed and ready for any threat that comes next.
Great, thank you. And, I've used my time, so I will yield back. Thank you.